of all, a very unique selling proposition is that our devices all run on cellular. All of them have SIM cards embedded into the devices, and we use a global partner, Vodafone, who has a global reach, and we have a roaming agreement, a business global agreement with Vodafone, and so the information goes directly through Vodafone cellular network directly to the cloud. That's something that nobody else in the world has. Most medical devices that are used for remote patient monitoring or telemedicine are either Bluetooth or Wi-Fi. And the big problem with both of those is that if you send home an 80-year-old patient that has a danger of having a stroke and say take your blood pressure and they have to pair a Bluetooth blood pressure meter, most of them can't do that. Or if it's Wi-Fi, how do you put it into your system at home? All of these sort of configurations things. And the doctors, on the other hand, they are very easy to configure devices because all they have to do is say, I'm adding a new device, here's the device number, and it connects it with the patient data, which stays in the clinical system. So on the one hand, it's the cellular with a SIM card-based technology for transferring the data. The other thing is that it's secure and it's private because the patient data stays in a patient system, whether it's with your physician or with the hospital or whether it's a clinical research organization, for instance. It stays secure and safe in their systems, well, as safe as they can make them. But we do not have the patient data, and the only thing that goes through our hub, which can be integrated into any of these systems, is the measurement data and the device number, which means that if somebody tries to hack the thing, all they get is they get a device number and they get one reading, for instance, 120/70 for a blood pressure reading, but the algorithm changes with every reading. It's hardware security on the chip, and so they could hack it once and get one reading, but that would be it. It helps nobody. So they really are not worth being hacked, and there's no patient data in it anyway. The patient data stays in the system, and our measurements are connected with the patient data in the system where it's supposed to be. So those are absolutely unique selling propositions, and it also means that easy, we always say easy always wins because it doesn't need to be configured on the hospital side, and it doesn't need to be configured by the people that take the devices home. They just have to use them.